Hello, I'm Dr. Premila, Professor, Department of Obstetrics and Gynecology, Amala Medical College, Thrissur. Today we are going to talk about menstrual hygiene and a little bit about menstrual cups. So menstruation, as you all know, it's a normal phenomenon. It's a physiological thing where at the end of every month or every 28 days, the lining inside your uterus gets shed off along with the blood in case you don't become pregnant. And many people believe that this blood is impure blood. Do you think it is an impure blood? Definitely no. Because if you become pregnant, this is the same blood that is going to supply the baby. So do you think a mother will supply the baby with an impure blood? No. So menstrual blood is as pure as any other blood. But like any blood which is collected outside the body for some time, it can get infected and can produce problems. That's why personal hygiene during menstruation is very important. In olden days, people used to use cloth pads. But we all know it's very difficult to maintain clothes pad, clean it and drying it, especially using sunlight, and keeping it clean and sterile is very difficult. And then people started to use pads. It was like a revolution. Everyone started using pads. But the problem that we all know is that even though it is very easy to use, disposing it is really difficult and it is not at all environment friendly. And you all know we don't have any idea how much amount of blood we are being lost when you are using a pad. So then came the latest one, that is the menstrual cup. I'm sure all of you would have heard about the menstrual cup. So what is the advantage of using a menstrual cup? So menstrual cup, the most important thing is it is environment friendly. You don't have to dispose it, you can reuse it, and it is cost effective also. Even though at the time when you're purchasing an initial cup, it might cost you a little bit more than buying a sanitary napkin, but this can be used up to 10 years. So over long run, it is definitely cost effective than a sanitary napkin. Not only that, this is very environment friendly. You don't have to worry about disposing it. You can reuse it after washing. And the most important thing is you can actually find out how much blood you are being lost. Many patients actually come to me after using menstrual cups saying that actually now only they understood that they are actually bleeding heavily. So it's actually a very environment friendly and a user friendly product. Coming to menstrual cup, I'm sure all of you would have seen a menstrual cup. The menstrual cup has got a mouth and if you look closely, there are small holes at the tip. These holes are the ones which maintains the cup in its place and keeps the vacuum. So it is very important that these holes are patent. If these holes are blocked due to some soap or anything, the cup cannot remain in place properly and it can leak. Then this is the actual part of the cup, following which you have got a stem. Some cups may have stem, some cups may not have stem. Stem is just for us to follow the cup and find out where the cup is. Other than that, stem doesn't have any purpose. And if you look at the cup is made up of medical grade silicone. So whenever you are buying a cup, you have to make sure it is a very good quality cup with medical grade silicone and is certified properly. So many people ask me which cup size we should use. So cups are available in 3 sizes: small, medium and large. Small size cup is usually for young girls, teenagers, those who are using it for the first time, those who never had sexual intercourse. Those are the people who will benefit from small cup. Whereas medium size cup is for those people who are sexually active or who has delivered by cesarean section, who never had a vaginal delivery. For them, it will be better if you use a medium size cup. And large cup is for those people who have delivered 2 or 3 times vaginally, where their vagina is much more lax. Now, using the cup, when you are going to use the cup, you have to take care of certain things. First of all, you should try to insert it only when you are menstruating, because if the blood is not there, the vagina will be dry. So it might be difficult for you to keep it inside. Or else if you're trying it at other times, then you have to make sure there are lubricant gels are available which you can use and apply that lubricant gel over this before you insert. But you should not use this for any other purpose. Like if you have got excessive vaginal discharge or anything, for that purpose you should not use this. This is strictly for menstrual blood. And your hand should be very clean. The cup should be made sterile. How to make the cup sterile? Usually it comes in a container like this and with a sack, and you can take it out. Either you can just put it in boiling water for 5 minutes to make it sterile, or you have got certain menstrual cup sterilizers. Ready-made menstrual cup sterilizers are also available like this, which it is very handy to carry. You can put in boiling water inside it and can keep it for 5 minutes, or you can keep these things in a microwave friendly ones are also there like this. You can use this microwave friendly ones inside which you can keep it and keep it in the microwave. So either way you can sterilize it, and after sterilizing only you should start using it, and your hands also should be clean. Now when you are going to insert, first you have to find a suitable position. Either you can sit on a commode, or you can stand near the toilet and keep your one leg on the toilet. And then when you are inserting, the cup can be inserted. Actually there are different ways to insert the cup. The two commonly used methods are, one is C or U. C or U means, if you can see here, you just fold the cup like this and then fold it like this. So if I keep it like this, now it will resemble a U. If I keep it like this, it will resemble a C. So both are the same. So by doing this, what we are doing is we are decreasing the diameter that has to be inserted. So this way we can insert. Or a better way will be the punch down technique. That is, you press from here. One end you press here, punch it down, keep it down like this and then fold. So now the advantage is one end has gone in. Only one edge is remaining outside. So again the thickness of the rim that has to go in will decrease. So both these are two commonly used techniques. Whichever method is easier for you, you can use. I usually prefer this punch down technique and then fold it like this. Now you with your left hand you separate your labia and then you insert it into the vagina. Your vagina is not straight, it is actually directed downwards and backwards towards your backbone. So your hands also should guide this towards back and posterior till you reach the cervix. Now this is the uterus and this is the cervix. Cervix means the opening of the uterus. So this is around this will be your cup will be remaining. So once you reach there, you will feel that resistance, you can take your hand off. Sometimes what might happen is, if you have folded it like this fold might not come out properly. So then what you can do is, you can just give a pinch here, it will open up, or else you can just twist it little bit, it will open up. And once you have put it inside, you have to place your fingers all around the rim and make sure it is properly opened up and sealed properly. You can try to give a little tug down, it will not come down easily. That means that it is safely in position. And you can leave it there. People say you can leave it for 10 to 12 hours, but I would rather say you keep it for around 8 hours. That will be the safest limit for especially people who are having heavy flow. If you are having a lighter flow, you can keep for 10 to 12 hours. And you can walk around, you can do whatever you want during this time. And when you want to remove it, what you have to do is, you again, same position which you adopted, which you have put in, you do, and place your fingers inside. Try to feel the stem so that you know where it is, and then never pull on the stem. If you pull on the stem, this vacuum is not broken, and if you pull on that, that can injure your vagina and it can be really painful and can produce problems. So never pull on the stem, but just follow the stem and reach the bottom of this cup, and then give a pinch at the bottom. Once you pinch the bottom, this vacuum will be released, and then gently you can take it out. Once you take it out, it will be filled with blood. Put it into the toilet, clean it with running water. Never use soap to clean this, because as I said earlier, if soap clogs these small openings at the tip, the cup will not function properly. You can also have something like Sensi wash. Intimate washes can also be used to clean the cup. And after that, you can use the same cup and put it inside. At the end of your menstrual cycle, 6 or 7 days of bleeding, you again do the proper sterilization and keep it safely inside the container. Okay. So this is how you have to use the menstrual cup. Now, are there people who should not use menstrual cup? Actually, anyone can, even teenagers, unmarried girls, anyone can use a menstrual cup. But if you have undergone any recent vaginal delivery within last 6 weeks, if you had a miscarriage in the last 2 or 3 weeks, if you had some surgeries in your vagina recently, or if you have a descent of your uterus, what we call as prolapse, that is your uterus or the urinary bladder is descending down, those people it is better to avoid using menstrual cup. Similarly, if you have put in an intrauterine copper T or something, for the first 1 week after putting the copper T, it is better not to use the menstrual cup because this vacuum can sometimes dislodge that. So these are the situations where you should not be using it. Other than that, there are actually and maybe if you are allergic to silicone also, you can avoid using this cup. Otherwise, there are no contraindications to using the cup. Anyone can use this cup. I think these are the common doubts which arises when we talk about the menstrual cup. Any other doubts I can clear? If you have got any other doubts, I can always clear it. Thank you.